Obviously, healthcare is, an industry that's very, very difficult to sort of do innovation in compared to some other industries because of the risks involved, right? You really care about not getting things wrong because someone with a stroke who, has a fall that could have been prevented is like a tragedy, right? And so I would love to understand a little bit from your perspective about, what are the sort of governance, compliance, and sort of security implications of trying to do this sort of work with such a new technology, or at least with, especially in the LLM world with sort of stochastic technology that's difficult to exactly predict like how it's going to behave. How do you as a healthcare institution approach mitigating and managing those risks and making sure that you're adopting the technology responsibly?
Yeah, so let me divide it into three categories. Let's have the technology that touches patients and changes, alters, or informs decision-making about a patient. That's all the way on one side of the spectrum. And then at the other end of the spectrum, it's task-oriented AI or technology that makes things easier and more convenient, but the consequences of a mistake are much lower. So an example would be if you use Google Maps or Apple Maps to get you from one place to another, and it ingests traffic patterns and weather patterns. If it's wrong, you aren't going to drive off a cliff because you're going to see that you're driving off a cliff and you're going to stop. So things like that are more easily adoptable and more easily diffused and promulgated. And then there are things that are in the middle. So for instance, in the middle would be AI agents helping a patient navigate picking up their prescription or getting in touch with their physician or preparing for a doctor visit or a surgery. So the first one's relatively easy. It's really technology and how cost effective is it. The second one is consumer centric. And I just like calling patients customers, but this is more consumer-centric because it's helping and assisting us care for patients without directly impacting decisions about their care. It's convenience and the routine and the mundane. So the routine and the mundane is where we've had the most deployment of AI because it's more easy to navigate. The part of AI that's very challenging from a patient delivery perspective is not just the implications of deploying the technology. It's not just about bringing it into workflows because that's important. It's not just about the change management, but the regulatory environment is extremely difficult and not yet set up for AI. I'll give an example. So we attempted to deploy an algorithm that predicts deterioration on inpatients, and it was FDA cleared and a fixed algorithm. But by definition, AI should be learning and getting better. It was not possible for it to learn and get better. We could inform the AI more accurately and deploy it more accurately. We were allowed to do that. The algorithm itself, we knew was getting better, but the one that we deployed was not the one that was FDA cleared. So we have to get through that from a regulatory hurdle perspective.